Now, from ABC4 News, coronavirus preparation versus panic.
Thank you for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. We begin tonight with a look at the best ways to maintain a healthy diet during a time of pandemic. We know it's not easy. Many of us are in isolation and are trying to limit our trips to the grocery store, which means making sure our families are getting the level of nutrition they need has become even more of a challenge. We turn now to Elizabeth Hanna, a nurse practitioner at St. Mark's Weight Treatment Center. Elizabeth, great to have you. Thank you so much for taking time to be with us.
Thank you for having me.
Very important conversation, staying healthy during this trying time. So as many of us are in isolation or quarantine, it may be easy to let our diets fall by the wayside. What are some of the nutritional pitfalls that we really should be looking out for during this time?
Yeah, I mean, I think it's really easy to try to treat this like it's a sick day or an extended vacation. And it's important to actually stick with a routine like you would normally so that you avoid sort of endlessly snacking and doing the sort of things that you do on vacation and treating yourself daily. It's really tempting to do that. And another big thing I think people are doing is a lot of binge watching of TV. I mean, Tiger King came out, we all went crazy. It's time to step away from the TV. Don't eat in front of the TV. Take that time as family time. You know, there's studies that show that when we eat in front of the TV, we tend to not only eat more, but people actually don't even remember what they eat. So take time away from the TV.
Yeah, I think we could all take a look at our lives right now and say, I could probably improve in that area. We'll get into a little bit more of that in just a minute. But first, you know, we're really trying to limit our trips to the grocery store. So with that in mind, what are some healthy foods we can keep in our houses that might stay longer in the fridge or even in our cupboards?
Yeah, I think I've definitely started reverting to canned and frozen fruits and vegetables more than I do normally. And there's a lot of really great things. There's a lot of frozen fruits that are already cut up, and you can throw those in a blender with some kefir, which is like a liquidy kind of yogurt that's packed with probiotics, that has more probiotics than regular yogurt. You can make a really healthy smoothie out of that. So don't be scared of the frozen and the canned vegetables. Sometimes I think we avoid those, but they're packed with nutrients too.
So kind of going back to the binge watching thing, the other day I was binge watching and I went through some Reese's Peanut Butter Cups pretty quick without even really realizing it. I have a feeling that's probably going to be part of your next answer. Foods that we should avoid right now.
Right. Yeah, I mean, I think we're all guilty of that kind of thing. You sit down, I mean, look at the movie theater. That's probably the only time we would sit down and eat. A tub of popcorn that big is in a darkened theater, and we're like, oh my gosh, really, did I really eat that? So, you know, we do that at home too. Just try to not indulge so much. I think that one of the other things that a lot of us are doing is trying to support local businesses, and there are other local businesses besides restaurants that are hurting right now too. So maybe instead of reaching for the takeout menu, think about sending somebody flowers or going to the bookstore. You can order books online. It's doing something a little bit more creative to support some of the local businesses, not just restaurants.
Any other tips to avoid stress eating, like maybe more healthy things we could be eating instead of the junk food?
Well, yeah, I mean, one of the stress eating things that I tend to do is I want something crunchy. So, you know, carrots are a great thing to replace instead of chips, and tortilla chips especially. That's like my guilty pleasure. So try to replace it with something like that. But I think that something that's really important to do is to make sure that you're doing something physical every day, and then also something creative every day. You know, not just emptying out your closet or reorganizing the garage, but something actually creative that is enriching your life. You know, what is that thing that you have put off? Do that, and that'll distract you from wanting to go back to your well-stocked fridge.
I would imagine lately you get a lot of questions about foods that could potentially boost our immune system. What are you telling people when you do get that question?
You know, I mean, I hate to be the bearer of bad news, but if you eat a diet that's full of ultra-processed foods, a handful of berries is not going to fix that. You know, if you don't eat a lot of fruits and vegetables, now's a good time to start. Don't think about just depriving yourselves, but start to add those healthy fruits and vegetables into your diet. One thing I see in my clinic a lot, though, is in Utah we are notoriously deficient in vitamin D, and that might be something that people want to talk to their healthcare providers about. It's important in the immune system as well as a ton of other systems in the body. It's not even fully understood in the way it works in a lot of ways, but vitamin D3 is something that a lot of us are deficient in.
Okay, any other tips or advice to keep in mind as to help us eat healthier while in isolation?
I think one thing that we all need to think about is that this is temporary. It will pass. You know, if you have put on a few pounds or if you put on more than a few pounds, don't beat yourself up. There's a multi-billion-dollar industry that is designed to make us feel guilty and try to tackle that on our own. It is actually a health issue. Obesity is a chronic condition. Go and seek help from professionals. At St. Mark's, we have a comprehensive team. We have registered dietitians, lifestyle coaches, and then I take a medical approach to try to help people reach their goals in a sustainable way. So get help.
And I also know that, which is very convenient in this day and age, that you guys have a telehealth option. Where can people connect with you guys and take advantage of that?
Yeah, if they go to weightlossutah.com, they can help them schedule an appointment, and telehealth is an option, so they don't have to leave their home. They don't have to drive up to St. Mark's. It's been great. I've actually really enjoyed doing the telehealth. That's been a silver lining for me. Okay,
and any advice on getting out and moving? That's probably important as well.
Yeah, I mean, we're so lucky. We don't have the population density of New York or any of these bigger cities. We can get out, and you can still keep your 6 feet away from people. Put on a mask, go for a walk. You know, if you are somebody that can't wear a mask, just make sure that you're giving people plenty of distance. Get out there. I mean, it sounds like we're going to have some really great weather, so get out and take advantage. Okay, Elizabeth Hanna, great information and tips for us tonight. A nurse practitioner and weight treatment center at St. Mark's. Thank you so much for what you do and for joining us. Awesome. Thank you. Still ahead, there's a rush to conduct clinical trials of possible treatments for COVID-19. But the FDA is warning not to jump the gun. The state of Utah's controversial $800,000 purchase of one such drug.
You're watching Coronavirus Preparation versus Panic.
Welcome back. When the coronavirus outbreak began, the Centers for Disease Control and Prevention listed cough, shortness of breath, and fever as possible symptoms. Now, the CDC has added new possible symptoms to that list. These possible symptoms added on Sunday are chills, muscle pain, headache, sore throat, and loss of taste or smell. The CDC also warning that these symptoms can appear anytime between the 2 to 14 days after exposure to the virus. The CDC did not update the list of emergency symptoms, which still include trouble breathing, confusion, bluish lips or face, and chest pain. Now to the controversy over the drug hydroxychloroquine. It's been touted as a potential treatment for COVID-19, but results from national clinical trials have been unpromising. The FDA cautioning against using the drug for treatment outside of clinical trials. Still, the state of Utah has spent $800,000 on the drug for possible treatment. Opponents say it's a waste of taxpayer money. Governor Gary Herbert and Lieutenant Governor Spencer Cox, who heads the COVID-19 task force, claim they knew nothing about the deal. ABC4 News has obtained documents confirming that purchase. ABC4's Brittany Johnson has the latest.
A new warning from the Food and Drug Administration about drugs President Donald Trump once held as game changers in the battle against COVID-19. Officials at the FDA warn against using hydroxychloroquine and chloroquine to treat COVID-19 outside of a hospital or approved clinical trial. The caution comes on the heels of the state's $800,000 order for hydroxychloroquine, a purchase Governor Gary Herbert said he knew nothing about at Friday's news briefing.
I have some questions about how it came about, the transparency of it, and a few other things too.
ABC4 News obtained these documents that show the governor's Office of Management and Budget approved an order for 20,000 packs of hydroxychloroquine from Meds in Motion, a pharmaceutical supplier. In a statement sent to ABC4 News, Paul Edwards, communications director for the Utah COVID-19 Community Task Force, says in part, on March 31st, 2020, the governor's Office of Management and Budget approved the purchase of 20,000 units of hydroxychloroquine as a potential treatment option for COVID-19 from Meds in Motion at a cost of $800,000. The state has not yet taken delivery of that order. State Representative Suzanne Harrison, a medical doctor, says the state's large purchase of hydroxychloroquine is concerning.
The jury is out. We don't know if this is effective, and until we know something is definitively effective or helpful, that's an irresponsible use of taxpayer dollars, in my opinion.
According to the FDA, hydroxychloroquine and chloroquine have not been shown to be safe and effective for treating or preventing COVID-19. The FDA authorized their temporary use in clinical trials, but cautioned against using the drugs outside of a hospital setting due to risk of heart rhythm problems. As of right now, it's still unclear what will happen happened to the state's close to $1 million purchase of a drug that now carries an FDA warning.
That's part of the review process to see what the obligations are that we have, and did we get something that was not what we bargained for. So that's yet to be determined.
Representative Dr. Harrison said Utah never needed a large purchase of hydroxychloroquine to begin with because the state already has a stockpile of the drug.
There are already more than 170,000 doses of hydroxychloroquine in the state of Utah. There has never been a shortage of this medication in Utah. There is no supply chain issues. I think that's a red herring argument. I don't think this is really something that the state needs to get involved in.
Maybe we didn't make a mistake. We need to wait and see. So I'm just a little reluctant to say how we got involved because I don't know for sure, although I've heard different stories. Bottom line is we're not purchasing any more of this drug, hydroxychloroquine. And the situation in its entirety is now under review by our legal counsel to see what happened and how it happened and why it happened.
Reporting in Salt Lake County, I'm Brittany Johnson, ABC4 News.
Coming up, illness, isolation, job loss. The stress of the pandemic can take a heavy toll. We get advice from a professional on how to make our mental health a priority.
You're watching Coronavirus Preparation versus Panic.
Right now, most of the country is under stay-at-home orders. Schools are closed and unemployment is at record levels. In a Kaiser Family Foundation poll earlier this month, 45% of people said stress related to the coronavirus had a negative impact on their mental health. For some tips on improving our mental health right now, we go now to my conversation with MONETTE, a licensed social worker at St. Mark's Hospital. Monette, great to have you with us. Thanks so much for being here. This is such an important conversation and something I've really been worried about because I don't think it's getting enough talk right now. So let's get right into it. What are some ways that can be helpful to really reduce stress during this very stressful time?
Well, you're absolutely right. A lot of people are really struggling right now, especially with anxiety and feeling overwhelmed with uncertainty in general. So one of the tips that the mental health professionals are giving right now are, to stay connected. There's, I think, a lot of my colleagues that were frustrated with the term social distancing. We wish it was physical distancing because a lot of people are really isolating themselves socially. And that, as you know, can lead to depression and actually make our anxiety worse. So staying connected socially is really important.
And let's get into ways to do that. How's the best way to stay connected socially? I mean, we have FaceTime and other opportunities as well.
Yeah, that's the good news is we actually have the internet now where, as other previous years in history, we didn't have that. So that is something we could use to our advantage. There's an example that I just saw in my neighborhood yesterday where they had divided the street and there was barriers and they were playing pickleball on either side of the street and they had their gloves and mask on. And I thought that was an awesome way to stay connected with their neighbors and in a safe way. Another example is, there's a lot of apps online. So there's one I think called Nextdoor that one of my clients used last week. She's a single mom and her daughter needed some art supplies and she didn't have any, so she put that on that app and within 15 minutes she saw on her front porch that she had art supplies delivered for her child. Yeah. So I thought that was a really cool story and just a really awesome way to stay connected.
I was out at Jordan Landing on Saturday out at a restaurant there and I saw families in the parking lot. Kind of their vehicles were in different spaces in the parking lot. They were tailgating, and that was also what appeared to be a very safe way to stay connected as well.
I love that. Yeah, that's a great example as well.
Okay.
There's ways to do it.
Yeah. So what are some specific coping skills people can try when they're experiencing things like anxiety and depression?
So there's so many, right? But one of the most important, probably one of the most effective that anybody can do is, number one, to focus on what you can control and let go of what you can't control. And probably the most important way you can do that is by staying focused in the present moment. We know that there's a lot of predictions about what's happening in the future. We can say, what if? We can think, what if? We can do that in front of our kids and make them anxious as well. or we can really stay focused in the present moment. So I actually teach an exercise to my clients called grounding. And in this grounding exercise, I just have them tap into the 5 senses and really pay attention to where they're at, and smells and sights. It was a warm day today. We can get outside and we can smell the fresh air, and we can, look at some colors. There's a lot of flowers out. And just tapping into that present moment and staying very present with whatever we're doing and mindful with whatever we're doing, that will really help reduce anxiety a lot.
Okay, so people are experiencing things they may not have before this pandemic, but others are dealing with pre-existing mental health conditions. What advice do you have for those who are probably feeling even more overwhelmed now that we're in the middle of this pandemic?
You know, I'm so glad you asked that because, I cannot ignore the fact that actually we've seen a rise just in the last 4 or 5 weeks in domestic violence. We've seen a rise in child abuse. This is really taking a toll on relationships in general, right? People are either, most people are at their worst, but people can also be at their best. So people with pre-existing conditions like kids with ADHD or people with anxiety and depression, those are the ones that need to seek support a little more actively. And there's actually shelters that are open. There's numbers that you can call. There's ways that you can reduce that loneliness and get extra help so that, and you have to work a little bit harder when you've got a pre-existing condition.
Yeah.
And so speaking up and asking for help and letting people help you is very key for people with mental illness to begin with.
Let's dig into that a little more, specifically people with children. Right now, children are at home all day long. Parents aren't used to that. It can be taxing. What advice do you have for those who are now dealing with children more than they have in the past?
So one thing we need to remember about children is they're usually not very verbal. They're not always going to tell us how they feel, but they will act out, right? So you can pretty much expect tantrums. You can pretty much expect them, being loud and losing their cool. You pretty much just need to expect that. But one of the things that you can do is allow them to express it. So any kind of art projects, chalk the walk is kind of a popular activity right now. I know my grandkids were out there chalking the walk and, just doing anything tactile with their hands or any form of expression other than verbal expression can really help the parents and the kids as well keep their peace of mind.
Yeah, I've been seeing a lot of that myself, and it looks great, actually, out in the community as well. All right, let's talk about one last thing. Right now, a lot of people are feeling anxiety, depression, feeling down. At what point do you need to realize, look, I need to go even further with this and get some professional help, or I can manage this on my own? What advice do you have for us then?
Well, of course, as a mental health professional, I'm always going to encourage people to get help, right? The issue at hand right now that's interesting is the duration. So I think anybody can struggle with depression or anxiety for a few weeks, but I think we're going on, week 5 or 6 here? And so the duration and the length of time is really taking its toll. And so I encourage people to reach out now. There's a lot of online support groups. There's a lot of apps that can help reduce our anxiety. There's one called Calm, where they do a lot of breathing exercises that can help. I do telemedicine and teletherapy. So I know that there's many websites where you can actually seek counseling online, and there's a lot of therapists that are doing that right now. I'm very busy, and I know a lot of my colleagues are as well. So there is always help available.
Yeah, I would imagine you are. Thank you so much. Again, a very important conversation. How can people get in contact with you?
So the best way is just our website at stmarks.com, stmarkshospital.com would be probably the best place to go, and we'll post a lot of resources there for people as well.
Okay, fantastic. Monette Cash, thank you so much for your time tonight. We really appreciate it.
Thank you.
Still ahead, for people who have fallen on hard times, local food banks are stepping up to keep Utahns fed. But the food banks need help to meet that demand.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting the soap, and you want to lather first, palms together. And you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this, and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb. And then the palms of your hands, you do the fingertips, around the palm in a circular motion. Get your fingertips nice and clean. And the other hand. And then my wrists. And that was 7 different steps. And if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy, and those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
Many Utah food pantries are struggling to keep up during the pandemic because demand is going up while donations are going down, but there are places to get help. Volunteers at Tabitha's Way in American Fork have been filling clients' trunks with staples like bread, produce, meat, and milk. The co-founder tells ABC4 they've seen a 20% increase in people looking for food assistance. People like Corinne Palagonia and her husband. He sells his plasma to bring in money because her hours as a hotel front desk agent have been cut, and her second job is at Lagoon, which is currently closed.
So we lost our apartment, so we're living in a hotel. And that's very expensive. It's like almost $400 a week and I'm the only one that works, so it's pretty hard. Well, I have car note, car insurance, phone bill, life insurance, health insurance, and rent. It comes out to quite a bit, but I'm trying the best I can to survive.
She says the food they do get from the pantry is a huge help at this time, as you might imagine. If you need assistance or would like to donate or volunteer, we have links for you on our website at ABC4.com. That does it for us tonight on this special edition of ABC4 News, Coronavirus Preparation versus Panic. As we learn more about this pandemic and new measures to prevent the spread, you can count on us to bring them to you. Make sure to stay with us on air and online. You can find us anytime, ABC4.com. You can also find us on Facebook and Twitter and log on and share your interactions with us for the very latest details there as well. Thanks so much again for joining us tonight. We will see you back here at 10 o'clock.